Okay, so I want to welcome you to this membership site. I am very, very excited to deliver you the latest news in healthcare and the education, primarily on MACRA. I am your go-to girl to get incentive money. I have worked very, very hard to get that title, so I will definitely work very, very hard for you. I've been in the healthcare field for about 20 years, and I have spent a lot of time getting doctors incentive money for their Medicare Advantage patients. And I found that I was really, really good at it, and it was very, very exciting. And it was nice to deliver them checks and say you did a great job, and here's the money that you didn't throw out the window. And I found that I loved to educate them, and we just had good relationships. So of course, that's what I'm going to do with MACRA. I'm going to do some MACRA magic and make sure that all of my clients get the money that they want. And now my clients are getting bigger because with MACRA, it's not just physicians. Now it's physician assistants and nurse practitioners and nurses and anesthesiologists and chiropractors and podiatrists. It's everybody in this field pretty much. And if they're not in it for 2017, they will be in years to come, probably 2019. So I am very driven, and I love healthcare, and I love the medical profession, and I value that people help save people's lives, and I love how intelligent people are, and I'm just super, super into this. And I am setting up this site because I want to touch all of you. I want to make sure all the information gets out there. I want to educate everybody. There's a lot of people that don't even know that MACRA is out there yet, and everybody has different, price points. So this was just one other way for me to help people on the back end as an administrator. I have my master's in healthcare administration. I also have a master's in psychology, so that comes into play as well. It always comes into play, especially in the medical profession, because it is an emotional profession. Despite what people think, it really is. It's emotions. You're helping people. The patients are emotional. Patients are happy when you help them, and patients, I'm a patient myself, and you just have to have compassion, and that's what I'm trying to say. I just love people have compassion, and I share that same compassion. I want to know who you are. I want to know your healthcare world, and I want this to be very interactive and serve as a networking tool. It's not just going to be videos from week to week to week. I'm going to throw in webinars. I have written articles. Everybody learns differently, so it's not just going to be this one method. But yeah, I have MACRA coming out of my ears, so let's talk about it. I am so happy that you joined, and I will answer your emails personally. My staff does not answer any of these emails. This is between me and you. This is our network. This is our community. So any ideas, any topics you want to talk about, shoot me an email. You have full access to me. You have full access to me. So that's the whole point in this. That's the big benefit. So let's do this. Let's talk about healthcare.